Thank you, Guten Morgen, and thank you all so very much for the honor of inviting me back. I was here in March of last year, and it is beyond my wildest dreams to see what the Germany BBF committee has accomplished. I think today is a very important day for the children and families in Germany, as we have heard from your highly esteemed government officials. So we know that there are a constellation of health benefits for the child and the mother related to breastfeeding and human lactation. Very exciting, recent epidemiological research is now consistently showing that the longer women breastfeed during their lifetime, the lower the risk of breast and ovarian cancer, as well as the lower the risk of hypertension, type 2 diabetes, and cardiovascular disease. We have also known for decades, and thanks to hundreds, if not thousands, of scientific studies on all over the world, that breastfeeding is indeed a triple duty action with children, because it helps prevent undernutrition and infectious diseases. It helps prevent the development of obesity and chronic diseases later on in life. And very importantly, it also helps with the development of the child. And the recent brain imaging research showing why breastfeeding improves the development of the brain is especially important. This slide shows to the right the much stronger brain development, neuronal connections among babies who are premature babies who are exclusively breastfed more compared to those who are exclusively breastfed less. And it is a very, very dramatic difference, the one that you can see through brain imaging. And these findings with premature babies have also been replicated with children born at term by the group of Dione and colleagues at Brown University in Rhode Island. It is because of this massive and conclusive evidence that both the World Health Organization and the Lancet breastfeeding series in 2016 confirmed that breastfeeding is an incredibly cost-effective preventive measure to improve maternal and child health and development. And it is very important, as it has been mentioned before, that these benefits not only apply to low and middle income countries, but to high income countries as well, as shown by the work of Melissa Bartik in the US in terms of the major cost savings to the healthcare system related to the benefits of breastfeeding, not only for children, but also for women. The Lancet breastfeeding series estimated that a staggering $300 billion are lost in productivity every year in the world because of the lack of adequate measures to protect, promote, and support breastfeeding. This is very difficult to understand why this is the case, because for decades now, we have had very strong evidence-based interventions that, if properly applied at scale, they can actually make a difference. And here we're talking about, first of all, the fact that we do have global consensus through the global strategy for infant and young child feeding from the World Health Organization and UNICEF with regards to the key breastfeeding outcomes and breastfeeding goals, including initiating breastfeeding within 1 hour after birth, exclusive breastfeeding for about 6 months, followed by the introduction of healthy and safe complementary foods, and continuation of breastfeeding until the child is at least 2 years of age. We have also had a very good code since 1981 for regulating the unethical marketing of breast milk substitutes. We have also had very good official documents from the International Labor Organization calling for maternity protection. And as we all know, the baby-friendly hospital initiative, when the 10 steps are properly implemented, they really work, and they can really work at scale. And last but not least, the World Health Organization just last year released the guidelines, the first ever guidelines on breastfeeding counseling. My research group has conducted half a dozen randomized controlled trials, and believe me, breastfeeding counseling works no matter in which continent, in which country the women are. So why, in spite of this massive knowledge about the benefits of breastfeeding and the major knowledge on implementation of programs, we still have very suboptimal breastfeeding outcomes globally? This slide, for example, shows that less than half of babies less than 6 months old in low and middle income countries are exclusively breastfed. And we have just heard that in Germany, we're also very, very far from actually meeting the recommendations. So some years ago, I'm sorry, my research group at Yale decided to do a major literature review and conduct interviews with key informants to try to identify which were the key ingredients or the key elements that successful countries with their breastfeeding programs had put into place. And it's actually that research question that eventually led to the breastfeeding year model. So the breastfeeding year model essentially builds upon a complex adaptive healthcare systems framework. And what it tells us is that everything starts with evidence-based advocacy that is essential for leading to the political will that in turn leads to the legislation and policies that are needed to release the resources that in turn are needed to build the workforce in the countries. Without the workforce in place in the countries, it is impossible to have successful long-term scaling up of breastfeeding programs. And we're talking about successful implementation in medical facilities as well as community settings. We also know that behavior change, social marketing, promotion has been crucial in countries like Brazil that have been very successful over 2 decades, dramatically improving their breastfeeding outcomes. At the end of the day, I could not stop saying this as an academician, but it is true. What doesn't get measured cannot be understood. What doesn't get measured cannot be improved. It's really the light that helps us look in very dark places, the data, especially from operations research, implementation science research, that allow us to truly understand, the right hand understand what the left hand is doing and where are the strengths and where are the gaps. At the end of the day, analogous to an engine, the breastfeeding year model needs a master coordinating gear for all the elements or each of the gears to move at the right pace, to communicate well with each other. And actually, this is a process that at the end of the day relies very heavily on building adequate management information systems that are decentralized from the national to the local level and allow for timely decision making at all levels. So this simple breastfeeding year model took us 3 years to develop because it started as a very complicated, complex adaptive systems model that no policymaker would ever understand. And we ended up with this model that I think has proven to be very helpful through the Becoming Breastfeeding Friendly initiative. So this initiative essentially has as a goal to create an evidence-based toolbox to help guide the development and tracking of large-scale, well-coordinated, multi-sectoral national breastfeeding promotion programs. And essentially, it is trying to help understand how the gears are performing in different settings. The vision that we've had since the very beginning was not to empower researchers, it was to empower countries to assess their current readiness for scale-up through a fully transparent, democratic, evidence-based, multi-sectoral, and multidisciplinary decision-making process based on the consensus of the key stakeholders. And that is the heart of the BBF vision. Through this process, it is expected that these committees will identify the key areas for improvement. They will not only identify, they will act upon them. They will make evidence-informed policy recommendations that can help enable the breastfeeding environments. And they will also empower the countries to monitor the progress with their scaling up. BBF is not intended to be a static, one-time process. It is intended to be a highly dynamic, iterative process. So in many ways, I don't want to disappoint you, but this is just the beginning of the new phase for BBF in Deutschland. So at the end of the day, as my colleague has just mentioned, it is crucial in our vision for the countries that are conducting successfully or not so successfully BBF to share their lessons learned with each other. Because at the end of the day, this must be a global effort. And through cooperation, also across nations, I think that we can start disseminating more and more rapidly successful scaling up of breastfeeding programs. So you can imagine BBF at the end of the day as a toolbox to help policymakers guide their scaling up efforts. Most policymakers I speak to, they are very sensitized to the importance of breastfeeding and they wanted to make it work. But many of them, rightly so, have requested roadmaps, blueprints. How do we start? Where do we take the process from here? So this toolbox includes the Bbf Index, and it has already been published if you want to look at all the technical details. But essentially, it includes 54 benchmarks across each of the gears of the breastfeeding gear model. And the countries get to score through their multi-sectorial, multidisciplinary committees, each of the benchmarks using evidence, and they look at by year. They can also come up with a total score or index at the country level. And very importantly, as I mentioned before, consensus must be reached. This is not even a process where the majority rules. It's a process where we need to reach social consensus and understand each other's points of view and understand how to best bring synergy, how to avoid duplication, and how to fill the gaps through intersectoral coordination. And yes, we have formulas, we have lots of numbers, but at the end of the day, it is a consensus that matters the most. BBF is, of course, not only an index, but it's actually a process to motivate a strong debate, strong discussion. So at the end of the day, as a result of 5 meetings, and Maria will go in detail through this slide later on, the committees can end up proposing simple, clear, feasible policy recommendations to their governments. BBF has been applied in 8 countries across 5 world regions. All 8 countries have applied the Bbf Index successfully, and 7 of the 8 countries have already reached consensus on their recommendation, which is why we are today here in Germany. Mexico and Ghana have done it twice. In all the countries, the government have ended up owning the process, even though the organizations leading the process have been different. In Mexico and Ghana, it has been academic organizations. In other countries, it has been mainly the government, the one that has run the process. But at the end of the day, we have learned that it is very feasible to do. The governments are being empowered. And at the end of the day, we're starting to see some important lessons with regards to what BBF is doing to generate very strong advocacy and improving the process of policy making. As the case in Ghana, where the First Lady has gotten very involved, especially pushing for better maternity leave legislation, and Ghana has also launched a major behavior change social media campaign called Breastfeed for Ghana. In Myanmar, the government fully embraced the top recommendation from the committee, which was to first of all form a national infant and young child feeding alliance. You remember that master gear, the coordination gear, there was none in Myanmar, and they understood that without establishing one, the effort is just not going to work. So very happy that the government has embraced it. And in Mexico, there has been enormous political support for implementing the BBF recommendations. This is a picture of the second BBF policy event that was hosted in the House of Representatives by Marta Trejos, the lady to the left, who is the head of the Family Commission from the House of Representatives, and to her right is the head of the commission at the Senate. So it was a very powerful event. Mexico now, for the first time, has a national breastfeeding strategy. The Mexican Breastfeeding Academy of Science, for the first time, published an official position recommending the breastfeeding year model as the model to follow in the country, and they commissioned 2 costing studies to better understand how much it would cost improving maternity benefits for women in the informal sector and for women employed in the formal sector. In low and middle income countries, over 50% of women work in the informal economy. In sub-Saharan Africa, 90% of women work in the informal economy. So this work is also going to be translated to the benefit of the world in the near future. So in the last 2 minutes that I have, I just want to mention that after all, we're also implementation science researchers, and my team continues to work very strongly on opening this black box of implementation to try to understand if and how BBF results in improved policies and breastfeeding outcomes at the end of the day across the globe. We're very engaged on doing a social network analysis, learning better how to map who are the key stakeholders and the level of influence that they have on each other when it comes to implementing the BBF recommended policies. And for the next 2 years, we will continue to do a lot of breastfeeding costing research. How much does it cost to extend maternity leave? How much does it cost to double or triple the coverage of the baby-friendly hospital initiative? How much does it cost to dramatically improve pre-service and in-service training in breastfeeding across schools of allied health? So I want to thank you very, very much for your attention. I have to congratulate the Pergamon Museum. I took this picture yesterday because this is one of the most beautiful depictions I have ever seen of a breastfeeding woman, and this was done in the 13th century in Iran. And I know this is an omen. This really means that today is a very special day in Germany, and I'm looking forward to hearing not only what are your scores and how everything went, but also what are your plans for the next phase of BBF in your country. Thank you very much indeed.